Okay.
Make sure
Put this on
video
YouTube.
has a good view, because that could.
Yeah.
Move my
You guys
head.
ready?
Yeah. Let me move
Okay.
my head.
So this is the left ventricle and this is the right ventricle. Right here is the anterior interventricular sulcus. This whole thing of fatty tissue is your coronary sulcus, goes all the way around. And if you look on the back, here's your posterior interventricular sulcus. So this part has all the blood vessels. If you follow this one here, this is the pulmonary trunk. And the pulmonary trunk is going to go all the way here to the right ventricle. This right here is part of the aorta, and there's actually another branch. So both of these branches are leading to the aorta. And you kind of have like the aortic arch sort of already forming. So you can see that this huge blood vessel right there is the aorta. And so if you go in here, you should be able to go into the left ventricle. Okay? Now, back here is your atrium. So you have the entire chamber all intact, as well as the auricle. So this little lip thing here is the auricle, and then there's the whole atrium. And you can see the superior vena cava. So this blood vessel here is the superior vena cava, and down here, kind of L-shaped, is the inferior vena cava. So you can go like this and like this. And those two, my watch is stuck on the tree. Help, get it out. Thank you. So this and this are your entries. So this is your superior vena cava and your inferior vena cava, and they're both leading into the right atrium. On this side, you have your left atrium, and here is one of the pulmonary veins, and here's the other pulmonary vein. So this would have still had two more entries because there's 4 of them. And then they lead into this. So what I want you guys to do is show the base so that when you fill it with water, I'm going to cut through the blood vessel here. When you fill it with water, you can see the valves. And so what I'm doing is cutting the wall. And what I want to be able to do is see here and see the valves. So one of you is going to hold this like this, and then another person is going to pump it.
Okay.
Okay? This is the pectinate muscle. This is what contracts to help the atrium finish ejecting. So what I'm going to do is just open this up. So that should allow you to see in and see the valves. Okay? Now, you have the coronary sinus, and this sinus is this thing here. This is going to drain into your right atrium. So if you were to stick a probe at the base of that, you come around here, and this is where you have your coronary sinus. So that's a pretty large sinus there. Okay?
Yes.
All right. So that's it for now. You guys can go fill it up with water.
Thank you.